obesity affects 1/3 of the United States population. The estimated cost of obesity in 2003 was $139 billion and is continually expected to rise. Over the past 3 decades, obesity rates have doubled among adults and tripled among children in the United States. Because of the rise in obesity rates, parents may outlive their children.
Why do we need to make people more aware of childhood obesity?
I think childhood obesity not only can cause psychosocial issues for the child on a personal level, but also it's a great health risk for our children. Obesity is one of the number one causes, of course, of some chronic diseases, cardiovascular diseases, high blood pressure, high cholesterol, type 2 diabetes. We are seeing an increase in the number of children with type 2 diabetes, and one of the causes of that has been linked, of course, to childhood obesity. So I think it's very important for the health of our children. We want our children to live long, healthy lives. We want them to have a healthy childhood as well as a healthy adulthood. So I think it's very important, to teach those healthy behaviors now. Some of the things that we're doing as far as the health department standpoint, we have a diabetes coalition here in our county. It was implemented in 2007. And one of our main goals with the coalition is to prevent type 2 diabetes. And one of our focus population is our children. So we do work closely with our school system. We have various partners and groups that serve on our coalition. We try to work with food services in the school. Some of the projects that we have done so far, a year ago we were able to purchase much needed PE equipment for our local high school and middle school. So anything that we can do to promote physical activity and nutrition in our children is one of our main missions.
Body mass index is a measurement used to determine overweight and obesity. It is determined by calculating the height and weight of an individual. A child is considered obese when their BMI is over 30.
Obesity leads to type 2 diabetes, cardiovascular disease, as well as other health problems. The health of a severely obese child is roughly equivalent to the health of a child with cancer undergoing chemotherapy.
Those who are affected by obesity choose to eat snack foods to comfort them. Statistics show that eating carbohydrates does help in the release of serotonin. This abuse of junk food often causes weight gain.
Are there any extra programs made available to school-aged children about obesity other than their regular health classes that may teach them about healthy eating and why it's important?
From a public health standpoint, as far as the things that we do here at the health department, one of our biggest programs, and it's for actually infants till age 5 years of age, is our WIC program. It's a program for pregnant women, infants, and children. It's a nutritional program. Other activities on the health department, public health level, we do occasionally go into the schools and talk with classes. We have various activities. We have Fruits and Veggies More Matters, a 5-a-day bingo game that we often play with our preschool and Head Start age. We also will sometimes go to the after-school programs and do nutritional and physical education activities with our kids. Our health educator also is readily available. Any requests that our educators have as far as nutrition, physical education activities, we try to participate in. So there are various things that we do on the health department level, but in the clinic, WIC is our biggest program.
School officials need to implement physical education as a regular part of the school day. Foods and beverages in the schools and cafeterias should be monitored to make sure they are healthy and nutritious.
An elementary school in Kentucky has recently taken on a challenge called Active 60. This program required their students to be active for at least 60 minutes, 4 days a week, and to record their activity under a log. Michelle Obama has also started a Let's Move program, encouraging both parents and children to be active, along with a city in Mississippi. who is not only encouraging children but also adults to get active and eat healthy.
Childhood obesity has been broadly researched, and schools have been identified as one of the most important issues concerning child obesity. With diet control and healthy activities, it has been proven that test scores could be raised. Children need structure to achieve academically as well as physically.
Children whose parents did not have a high school diploma had a higher BMI than those whose parents had a college degree. A child who attends a public school has a higher BMI than a child who attends private school.
In your opinion, what is the main cause of childhood obesity?
Well, I think childhood obesity has definitely increased over the past few years for various reasons. Genetics does play a small part. However, most of the causes are lifestyle choices. We know over the past 20 years, portion sizes of foods have drastically increased. Kids lead more sedentary lifestyles, TV watching, video games, things like that. We're busy. We all are very busy. Parents work. Kids are involved in extracurricular activities. It's really easy to hit that McDonald's drive-thru oftentimes on your way to an event or after a ball game. So I think that has played a big part in it. But mainly sedentary lifestyle and then our nutrition as well.
The program Let's Move should encourage parents to set aside family exercise daily. Parents have to limit television time, computer time, and encourage physical activity as well as good eating habits. It is also important to initiate portion control, eliminate high-calorie convenience foods, and sugary foods.